So, sitting comfortably with a little bit of support behind you, and how you place your legs really depends on where you're at in your pregnancy and also where you're at with your hips today. So if you are having any symphysis pubis dysfunction, or if you just feel that you want to stretch the legs out, if you've been kind of sat at a desk all day, you might feel that you want to get some length into the legs, and you can sit with them out, maybe roll them in and out a few times, get a little bit of movement into them. If you are, again, more than 37 weeks, we don't really want to sit cross-legged because it creates too much compression in the veins, carrying the blood back to the heart. So you want to have a bit more of a spacious seated position, particularly as it relates to the back of the knees. So again, sitting cross-legged, there's quite a lot of compression in the back of the knees and it will restrict the blood flow. So something like butterfly pose, or again, that wide-legged position. Now you might want to sit in butterfly pose even if you're not 37 weeks, because you might want to stretch your hips out a little bit and you might feel it's really comfortable. So soles of the feet together, spine lengthening up. So again, that can be another option. If any of those don't feel comfortable for you, then just good old-fashioned cross-legged is also quite useful if you're less than 37 weeks. So just finding whatever works for you. And just resting your hands onto your legs, and what you might find is if you turn the palms upwards, so the backs of your hands are on the legs, you'll notice that you have a little bit more space in the chest. So when we have the palms down, it internally rotates the upper arms slightly, but then it brings the shoulders round and down. When we put the backs of the hands on the legs, it externally rotates the arms, and that lifts the ribs, opens the shoulders, and you've got a little bit more space to breathe. So then just closing your eyes and just centering and settling yourself. Just coming into complete stillness. Take a moment to move your attention around your body and just notice how that feels this evening. So noticing all the main areas that you might have some niggles or aches or discomfort. So things like the hips, the lower back, the pelvis, the upper back, the shoulders, the neck. And then moving your awareness to your baby. So noticing what is currently happening in your belly. And that will vary from moment to moment, and also it will vary relative to the place that you are in your pregnancy. So you might not have any movements yet. If you're less than 20 weeks into your pregnancy, then you might find that you might get a little bit of fluttering, but nothing particularly noticeable. And then as you progress into your pregnancy, you'll start to feel those little fluttering movements becoming bigger, becoming more noticeable, until towards the end of your pregnancy, you might notice really big movements. And then there are times when your baby is resting and sleeping. So even if you are getting some big movements at the moment, you might not have them at the moment. They may be in one of their resting phases. And then tuning your awareness to your breath. And it's this connection to the breath, forged gently over the weeks and the months that you may be here in the classes, that guides you through to your labour. So just becoming aware of your breath at the moment, noticing how it is. Are there any feelings of restriction? Are there any feelings of breathlessness? And again, these are all very common, and we can work with them. So if you're feeling that you're reducing your capacity to breathe deeply because your baby is now quite high up, the uterus is quite high up, pushing against the diaphragm, think about breathing sideways. So think about drawing the breath into the sides of the ribs as you breathe in. And then releasing from the side ribs as you breathe out. So this helps you when you can't kind of breathe vertically anymore, when there's no space for the lungs and the rib cage to expand downwards. So think about breathing out to the sides instead, almost as if you're breathing in towards your armpits. If you're in the early stages of your pregnancy and you may not have much restriction from the physical side, but you are still breathing for two, and so your baby takes up quite a significant portion of your oxygen. But also the oxygen carrying capacity of your blood is a little bit reduced because it has to be thinned out so it goes further. So you've got less hemoglobin. And that can also lead to a little bit of breathlessness. So how we can work with that is to just control our breathing a little bit more. And when we breathe consciously, we take more oxygen in. So what I'd like you to do is to create just the slightest of restrictions in your throat. So some of you will have done this before. It's called ocean breath, or ujjayi to give it its Sanskrit name. And it's very similar to the sensation we make when we sigh under the breath, and we make a little sound, but with the mouth closed. And then we see if we can maintain that restriction as we breathe in and as we breathe out. And what you might find is that you've got a little snoring sound that connects to your breathing. But also you'll notice that it slows the breath down. And in addition to that slowness of the breath, you've also got this sound now that you can tap into. And also a slight improvement in your oxygen intake. So just carrying on a couple more times with this ocean breath. And then you can just park that breath for the moment, and we will keep coming back to it. It's such a good breath to work with. If you're sitting cross-legged, which I don't, just you, that's fine. What I normally would say, and I'm going to do the same, cross them the other way now, so that you're stretching the other side of your pelvis. It's going to feel really odd, because we'll always go the same way. So now you're going, oh, these don't feel like they're my hips or my legs anymore. It's quite a common thing, but it's really good, particularly when you're pregnant, to balance what you're doing in the body, because everything's softening now. And so what you don't want to do is kind of reinforce any asymmetry, because you're always kind of leaning one way or sitting one way. So it's a good thing to do to cross them over the other way quite regularly. So you're going to take the hands, you're going to interlace them, and then just release the index finger. And then you're going to pull the thumbs back, and you'll have like a little diamond shape between the fingers. Yeah, and then bring the hands down. You're going to rest this over the belly. So this is the mudra, or the hand gesture, the hand symbol for the womb, and it kind of does look a bit womby-like. And it's called yoni mudra. So in Sanskrit, the yoni is the womb. And there's a lot of spiritual significance to the yoni, of course, because it's, it's the birthplace of everything, isn't it? So the yogis really held a lot of praise and honour to this sacred space, the yoni. So then as you breathe in, you're just going to bring the hands up as high as you can, and then you'll have to turn them the other way around and continue Oh, I've gone the wrong way. Sorry, mine's going forwards, but yeah, it's not going to work, is it? So inhale, we go forwards and up. That's better. Reaching all the way up. Lift the rib cage as well. So rather than lifting the shoulders, lift the rib cage. And then on the out breath, with that slow ujjayi, come down, and then towards the end, you turn it back down to symbolize the yoni as you come back to your belly. And then the same thing again, breathing in, reaching up. Breathing out with that ujjayi breath. And then hands back to the womb. So just do that a couple more times, just following your own breath. And just one more. And then just maybe shake the hands out, shake the wrists out. So our theme today, we're going to work through all of the birthing breaths and kind of integrate them into various postures. But we're also going to work on the back and a little bit of shoulder and neck as well, because they're kind of all connected. So I'm going to ask you to come slightly away from the wall now, because we're going to start doing things which need a bit of space behind. So now you've got to sit up under your own steam. So you might find it more comfortable, like I'm doing, to sit on a block or to maybe sit on your cushion. And I've got some spare blocks. Well, I've got one spare block, the rest of them are there. So are you all okay to sit on something, just to tilt the pelvis slightly forward so that you feel like I've got one block, anybody wants it? First come, first serve. Okay. So we're going to bring the fingertips onto the shoulders and just do some really simple shoulder work. Bring the elbows together. Take the elbows up towards the ceiling and then circle them all the way back and down. And just about a few times. So it's quite nice to stretch open these muscles, particularly if you've been sitting at a desk today for a long time. And you might get some clicking. Might get some grinding and some crunching. So just noticing how that is. How are your shoulders today? What's happening in your shoulders? And then the next time you breathe out, just give them a little bit of a wriggle and a shake. So then we're going to do some neck moves. These are really gentle neck moves, but they work really well at freeing up any tightness you might have in your neck. But they also work on the parasympathetic nervous system, which is your rest and relaxation response. It's that the quieter side of your nervous system. It's the opposite to the fight or flight. So if you want to calm down, quieten the mind, and sedate your nervous system, these neck moves are really, really good. So notice how you feel at the end. You know, just take stock of how you feel now mentally. How's your nervous system at the moment? And then we'll check in again at the end and see if there's any change. And also, going to work on the neck. So you want to maintain a long upright spine. So if you kind of lost your pose and you're slumping forwards, it's going to affect how the neck is going to move. But you're very welcome to have this one and only block that I've got left. Used to have loads of kit, didn't I? Do you remember? I had a bag, I had an IKEA bag, and then COVID happened and I had to get rid of it all. So I might slowly start to gather it all back again. Okay, so just closing your eyes. And then just becoming aware of your breath. The next time you breathe out, you're just going to gently ease your neck, your head around to the right. So you're not forcing the head to move, you're just kind of releasing it almost to the right. And then as you breathe in, the head comes back to the centre. And then do the same on the other side. So turn the head to the left. As you breathe out, and as you breathe in, the head comes back to the centre. So we're going to do that 2 more times. So you're moving the head away as you breathe out. And we're not trying to integrate all of the neck muscles. It's almost like you're releasing or relaxing into the stretch, into the movement, without putting too much force or effort through the neck. Because when we put effort and force through movements, we actually tighten the muscles, we engage the muscles, and what we want to do here is release them. So doing the moves on the out breath allow us to engage in that more releasing, relaxing and surrendering part of the breath. You might also find that with each repetition you can get the head around a little bit more. So once you've completed 3 rounds on each side, you can bring the head back to the centre. Then we're going to go side to side. So the next time you breathe out, just take your right ear over towards the right shoulder. And then gently bring it back to the centre as you breathe in. And the same on the other side. Exhaling. Head comes over. Inhaling back to the centre. And again, just do that 2 more times, using your out breath to gently ease you into the position, and then you use your inhale to come out of the position. And then again, once you've finished, just coming back to the centre. Notice if you're beginning to get some freedom in your neck. And then the last movement is an up and down movement, but it's quite a tricky one to not engage the neck. So you don't want to push the neck forwards and backwards. You want to keep the neck really static. And all you're doing is hinging your head, the skull, on top of the neck. So just check that it's just your skull moving and not the neck. So the next time you breathe out, you're just going to dip your chin down towards your chest and lengthening the muscles in the back of your neck that connect the base of your skull to the neck. And then breathing in, just bring the head back to the centre. Now breathing out, lift the chin, but again, don't bend the neck, just hinge the skull. And then inhaling, bring the head back to the centre. Just do that twice more. Once you've done that 3 times, just noticing, first of all, how does the neck feel? So particularly if you are working with some stiffness, notice if there's any release, but also notice that quality in the nervous system as well. Has that done anything?
Yeah, it's way better. It's clicking a bit at first, but
yeah, it's like repetition all the time, because you know that eventually you kind of like soften everything. Yeah, so that's what I use that quite a lot to loosen my neck, and it's not an aggressive form. I think with the neck, you've got to be really careful. So these gentle moves are quite effective. Okay, let's have a look at some back stretches. So you're going to start lying on your back, and then we're going to stretch arms and the legs out. So I'm just going to show you how much space you're going to need. So you might all need to come. So at some point we're going to do this. So the arms are reaching back, and the leg is stretching out as well. So you're probably going to need to be your mat is going to need to be probably that far away from the wall. So you're inching ever closer in towards the middle. Have you got what you could do, Charlie, is maybe angle? Yeah. Have you got any angled space?
Yeah.
So just make sure when you lie down that you've got that much space behind you. So to put your arms all the way out. Oh, it's the joy moving up and down now, isn't it,
I was
Leah?
going to do it without getting a foot.
Bottom shuffling your bell. Yeah, it doesn't work. They're designed to be really grippy. Okay, so coming down onto your back, and then the first thing to do is to just bring the knees up into the chest. Now obviously you've got a baby in the way here, so you'll need to take your knees either side of your bum and place your hands onto the knee or onto the shin, and then it's quite nice to just kind of roll the knees around here. So we did a bit of this last week, and it's surprising how much tension and congestion we hold in our sacrum when we're pregnant. So the sacrum is the back of the pelvis, and it often gets mistaken for backache, but it's actually lower down. It's not in your spine, it's in the back of your pelvis. And there's a lot happening here. There's a big plexus of nerves, the sacral plexus, and these nerves feed your uterus, your bladder and your bowel. So everything that happens in your lower abdomen, from a nervous system perspective, nerve endings come through the sacrum. So just rolling around here, and you might find some sweet spots where you want to spend a little bit more time, because sometimes one side is tighter than the other, one side's a bit more crunchy than the other. So just playing around, seeing what you can find. And then once you've done that to your satisfaction, you're going to bring the feet down to the floor. You can have them a little bit wide, particularly if you're in the later stages of your pregnancy. And then you're going to draw your arms out at shoulder height and just drop the hands down onto the floor. So then you're just going to take both knees over towards the right side. Keep the left shoulder rooted down to the ground. And this is going to stretch out your lower back. It might stretch your waist, your ribs and your upper back if they're tighter than your lower back. So again, all these stretches will be different depending on where you are more kind of restricted. Where is the tightness in the muscle here? And then you're going to breathe in and bring the knees back to the centre. And then you do the same to the other side. So now take the knees over to the left side. Let the right shoulder anchor really strongly down to the ground. And just notice how it feels on this side. Is the twist different? Is there more tightness here? Is there less tightness here? We are rarely symmetrical because we use our bodies in particular ways that kind of reinforce an asymmetrical movement of the muscles and of the skeleton. So it's really common to find that every move you do from one side to the other will be a little bit different. And then inhale the knees back to the centre, and then exhale them back over to the right. So we're going to do a few repetitions here, because as I mentioned earlier, the more repetitions you do, you often find that everything loosens up a little bit more. And I'm going to invite you to choose your own pace, and that will depend on how you feel. So you might want to work quite dynamically. Exhale, knees over, inhale back to centre, exhale, knees to the other side, inhale back to centre. So just using one breath per move. So you get through the stretches quite quickly. Or you might actually feel that you want to hold the pose. You might decide that the back or the pelvis feels really tight on one side. So you might prefer to actually stay for 3, 4, 5 breaths with the knees over to one side before you change sides. Again, you can play around here and just work with whatever feels right for you. Notice if the back is starting to loosen. So a little bit of freedom, a little bit of softness beginning to emerge. And then can you just complete one more round? And then once you come back this time, we're going to do a little bit of strength work. So obviously it's very difficult to do a bit of core work when you're pregnant, but this is probably about the best you're going to get. So, and it's quite a nice lateral, a diagonal stretch through the body. There's a little bit of toning through the abs. It's nothing big. So having the knees bent again, soles of the feet on the floor, and then what I'd like you to do is engage the lower back into the floor. So your pelvis will tilt back slightly, and you're going to try and maintain the connection between your lower back and the floor. Now in a minute you're going to straighten one of your legs out, and as you do that your pelvis is going to want to go with the leg, and you have to resist that by keeping the lower back pushing into the ground, and that is going to require your abdominal muscles. So see how this goes. So lower back pushing into the ground, maintaining its connection. And the next time you breathe in, you're going to slide the left leg out along the floor, push the heel away, and at the same time raise the left arm back behind you. So you've got a full stretch through the whole of the body. And then as you breathe out, keep the lower back pushing into the ground as you bring the knee and the arm back to the starting position. And then do the same thing again. So lower back pushes in, left leg, push the heel away, right arm extends all the way back. And inhaling, it's coming all the way back. So we're going to do this a few more times. And again, I'm going to give you the option to carry on in this way, this dynamic, breathe in, breathe out variation, where you're moving in the rhythm of the breath, or if you like the stretch, you can actually hold it for a couple of breaths and really work the heel away, really work the fingers away, and then you can swap over when you feel that you've done justice to that stretch. So I'm going to just do one more on each side. So you're finishing, we did right leg first, didn't we? Right leg, left arm. So you're finishing with the left leg and the right arm. And then when you're finished, we're going to come and roll over onto your right side. We're going to do a little bit of stretching out. I appreciate half of you are going to be facing the wrong way. So Lexi and Claire, do you want to go on your left, but just understand that all the instructions are going to be in reverse. And if you're on that row, you can come sideways if you want, or you can see me there. You can see me, you're fine. So, supporting the head and the hands. So I think we did the clamshell last week. It's a really good one to practice regularly because it helps to keep the pelvic girdle muscles strong. So this strong pelvic girdle muscles prevent you from getting symphysis pubis dysfunction. So the knees are bent, the ankles stay together. We're just going to do a shortened version of this. I'm going to add a few other leg moves in. So as you breathe in, you're just going to lift the top knee up. Now you're not aiming to get it all the way back because then that's engaging your lower back. We just want to work the glutes and the hip flexor muscles. So the hips stay where they are. You lift the knee and you should start to feel it in bits and places in your buttocks. And then exhaling and low down. Now if this is particularly difficult, then you need to do this because it means that the muscles are quite weak. And where the muscles are weak, this is often a precursor to developing symphysis pubis dysfunction. And the interesting thing is the people that don't get it are horse riders. Anybody ride a horse? No horse riders. Okay. Yeah, because they're permanently gripping all of their muscles. They're using their pelvic muscles all the time, and they never get symphysis pubis dysfunction. So that's the first one to do. But then we're going to do a little bit extra. You're going to straighten the top leg out, push the heel away, and you're going to hover it parallel to the floor. You can use your left hand on the ground if you want to. Now we're going to slowly take that leg forwards, just as far as it will go. And then we're going to slowly take it backwards. So Melissa, if you can you, I'd have your leg high up. Yeah, that's it. So just completely parallel to the floor. And then you're going to take it back as far as it will go. So you're getting a bit of a quad stretch on the back as well. How are your legs, Melissa? They calm down?
Calm down, still occasionally, but much better than it was.
Okay, brilliant. Yeah, the body's getting used to the lack of exercise.
Yeah.
And it's interesting, isn't it? Thinking, you know, with all the Commonwealth Games and everything that happens, you just think all these women, all these athletes that have babies, you can just see how much it limits their potential to be all that they can, because they have to spend a good year out of action and losing all that time, and then having to sort of start again. It's very hard, isn't it? Had you had plans to be an elite athlete, Melissa?
Yeah, I had actually, which is a shame.
Okay, so from here, I'm going to bring the knee into the chest and take the knee up to the ceiling, and then just draw it in towards this nice hip stretch, and also stretch with the inner thigh. If that feels okay, see if you can straighten that leg up to the ceiling. So now we're going to get into the hamstring to see what's happening here. And again, if you want to go a little bit further here, and you don't have to, you can point and flex the foot. I can't, I've torn my Achilles. See my beautiful pink tape, so I'm just going to hold my leg there. But for you, you can flex and point the foot, and that will take you deeper into the calf muscle. And just explore what's happening there. Oh, you've all got good hamstrings, ladies. Excellent. And then bring the knee all the way back down. And then you're going to come back onto your back. And we're going to do something here before we do the other side. So, coming onto the back of your body. And now we're going to do some back strengthening work. So these are the back bends, back bending practices that we do, and it engages the back muscles and makes them stronger. And this is really the only option we've got, because normally we would lie on the belly to do these moves, but obviously you can't when you're pregnant. So you're going to have your feet hip distance apart and fairly close in towards your body, but not all the way in, because it'll stop you from being able to rise up. Ideally you want your shins vertical. You've got the option, if you want, to take your arms back behind you and lay them flat on the floor, and this opens up a bit of a stretch into the upper back and the shoulders. You will need to take the arms sort of not completely parallel to each other, so widen the elbows and then widen the wrists as well. First thing you're going to do is push your feet into the ground and start to engage the leg muscles. And you'll notice when you push the feet in the ground that the lower part of your pelvis starts to lift. So you can see the beginning of that journey. You keep pushing the feet into the ground, and then you'll find that the hips lift up. Keep pushing the feet into the ground, and then you'll be able to gently lift a little bit more of your back away from the ground. So just see where you can come up to. And then you slowly come down, one vertebrae at a time if you can. And in particular, push the lower back into the floor. So there are various ways of doing this with the breath. Sometimes you can breathe in to come up, breathe out to come down. You can reverse it, breathe out to come up, breathe in to come down. Or you can actually take several breaths and really work to climb up into the pose, taking as many breaths as you need to ease yourself all the way up, still working those thighs, and then again just easing down, taking all the breaths that you need. So we're going to do this a few more times. So it's actually quite a nice stretch for the front of the body, which you don't often get during pregnancy. It's probably one of the few poses we've got where you can just invite a little bit of space into the body. So let's see, I'll take your wrist maybe a little bit wider. Yeah, that's it. Now they're all touching the ground. You get a little bit more of a stretch in the upper body. What you'll also feel as well in this pose is it's stretching the quads, but it's strengthening the buttocks and the lower back muscles. So can you just do one more, unless you've had enough? And then when you come down this time, you're going to roll over onto your left side. I'm going to do those movements, those strengthening movements. So lying on the left side, knees are bent, ankles on top of each other, head resting in your hand. You can have your right hand on the ground in front of you. So keeping your ankles together, knees need to be quite bent. And then you're going to lift the top knee up without the hip tilting backwards, and then lower the knee down. So I'm going to do that a few times. So again, you're aiming to get the work into your thigh, but mostly into your pelvic girdle muscles. So a bit of glute, a bit of hip flexor. So I've noticed in the last few years in sort of the yoga world that people are calling the quads the hip flexors, which is technically correct because flexion is a particular movement, but they've got their own name. They're called quadriceps. So there's also a hip flexor. They don't have another name. These hip flexors, muscles that are like your saddlebags on the outside of your pelvis. These are really important as well. I think it's called the adductors are on the inside. Anyone know what this muscle is on the outside? Yeah. So I call these the hip flexors as well. And these are the muscles that we want to create some strength in. So they're called the pelvic girdle muscles. That gives you an idea. There's about 6 or 7 of them. And they create a supportive girdle all the way around your pelvis. So now you're going to take the right leg and you're going to bring it parallel to the floor. Push the heel away and then just gently draw that leg forwards as far as it will go. And then take the leg all the way back as far as it will go. And the slower you move, the more you have to use your muscles. And this is why yoga is actually quite strengthening when we do things slowly. So if you do things quickly, you're using momentum to get yourself from A to B, and the amount of muscle that you use will be minimal, or the amount of muscle toning that you do will be minimal. But just look how hard it is to do this movement slowly. The slower you do it, the more muscle you have to use. You're feeling that burn in your hips and your glutes. Lovely. Okay, so now you're going to bring the knee in towards your chest and then turn your knee up towards the ceiling. Bring the knee into your hand and just squeeze the knee up towards your head. So you're getting that stretch on the inside of the leg. So it's a little bit of a perineal stretch this as well. So we have done a class on perineal stretching quite recently. Oh, that was a joy, wasn't it? Talking about perineums and stretching. But this is another way of kind of passively stretching the perineum. And then from here, just extend that leg up to the ceiling. You can hold the leg wherever you're comfortable, just exploring your hamstring. How is the hamstring on this side? And again, you can point the toes, pull the toes towards you. And then come all the way down. And then from here, just gently push all the way up. Okay, lovely. So we're going to come and kneel Is everybody okay in this position? Because you might have knee problems, you might have ankle problems. Some people have broken their ankles sometimes can't flex them enough or to actually be able to sit on them. Are you all okay? There are alternatives, but you're all fine. Okay, so our next breath, so we've done somewhat with Ujjayi breath or the ocean breath. Another really nice breath to work with, bee breath, and it's just exactly what it says. You're just going to hum like a bee. So if you haven't done this before, you're probably going to think, oh, that sounds a bit stupid. Yeah, it is, it's really stupid. But it's really, really an impressive breath. It gives a vibration to your babies. It's very good for connecting with your baby and also for calming your baby down. We used to do them a lot in the postnatal classes. Babies go really quiet just by humming to them. But it's also very good for lowering high blood pressure, and it's really good for calming down the mind. You know those days when your mind just won't shut up and you're really struggling mentally? It's really, really good for that. So you're just drowning out all the noise in the mind. So the movement we're going to do is we're going to inhale, we're going to rise up. Now, I would suggest a couple of things here to get you up. The first is push into your shins. That'll get you so far. And then engage your pelvic floor muscles. So you're using a bit of pelvic floor as well. So that's going to get you up from the floor. In addition to that, you're going to take the arms all the way up. And if you fancy it at the end, you might actually want to do a little bit of a bend. I would suggest not doing it from the lumbar, so lumbar back bends, we've done one already, and actually your back is quite often hyperextended in pregnancy. What I would suggest is getting the stretch into the thoracic spine instead. So if you do take the arms up, do it from lifting the rib cage and arching back from the upper part of the spine rather than this, okay? It's not great to do that in pregnancy. Excuse me. So that's on the inhale. And then on the exhale, we're going to come down. That's where we're going to use the bee breath. As we breathe out, we're just going to hum. So it's going to look like this. And what you'll notice is the breath is really long. And that's one of the reasons why we use it. The out breath in labour is the most useful part of the breath. And particularly for the second stage when you're pushing, but also during the first stage. It's the relaxing part of the breath. And so in all of the breath work that we use in pregnancy yoga, we utilise ones that lengthen your out breath. So the challenge is to see if you can slow that descent down. So remember what I was saying, the slower you move, the more the muscles have to work. So coming on to the knees. So just breathing in normally, push into your shins, engage the pelvic floor muscles, lift the ribs up and away from your baby. Maybe just open the arms a little bit. And then deep breath to come down. Now obviously I've got longer breath. I've got a baby taking my breath. So don't think there's nothing wrong with you. You've just got breath going two ways. Okay, same thing again. Breathing in, pushing into the shins. Pelvic floor engages, rib cage lifts. Maybe a little opener. And then bee breath to come all the way back down. Is that all okay for everybody? Do you want to do a couple more? Okay, so going in your own time, inhaling, pushing into the shins, lift the pelvic floor, and lift the ribs, open up a little bit through the upper body, and then bee breath, easing all the way down. And then once more. Okay, lovely. Then you're going to come over onto your hands and onto your knees. So this is probably the number one move for pregnant backs. And it's one that I put into pretty much every class. So if you've been coming to the class for some time, you'll be able to do this in your sleep. It's a really lovely stretch for the lower back, and it decompresses all of the congestion that you might have in your lower back. You need to make some space between your knees that is big enough to fit your baby, because you're going to come back onto your heels. So just going to measure that for the moment. How wide do your knees have to be so that your baby can snugly fit inside the legs? And then once you've measured that out, keep them there and come all the way back up. So we're going to work with the bee breath again. So it looks like this. On the inhale, we lengthen the spine. On the out breath, you tuck the tailbone under, you round the back up to the ceiling, and you try and arch the back as much as you can. You'll feel your baby moving up in towards you. And at the same time, you slowly take your hips back towards your heels. And you need to keep that rounded position with your tailbone tucked under as you take the hips back onto the heels. If you lose that tucking under of the tailbone, your lower back isn't as extended as it would normally be. So I'll just show you the difference if you're not sure. So this is how we want it to look. Can you see there? You can see my bum. Tailbone tucks under. You can see how big my back is, but how rounded my back is. But what I want you to look at is this bit here, lumbar spine. This is extended, and as I come down, it stays in extension because I've still got my tailbone tucked under. Now that is very different. So look what happens. A lot of people do this. Oh yeah, I'm going back. I'm going to do that. And then they come back, and I've lost pretty much all of the stretch. It's a nice stretch for the hips, but you're not getting that lumbar decompression. And this class is about the back, so we're looking at the back. Okay, so we're going to do that a few times, using the bee breath to go backwards. So inhaling and lengthening. Tuck the tailbone under, around the back. And then slowly descend back onto your heels with the tailbone still in its tucked under position, so you really feel the lower back being lengthened and elongated. Then to come up, push into the shins, engage the pelvic floor, lift the ribs away from your baby, just as you did in that last one. Same thing again, bee breath, tailbone tucks under, spine extends to the ceiling, and then you keep the back in that rounded position as you gently ease all the way back onto your heels. And as you breathe in, push into the shins and rise up. Okay, just do that 2 more times. So Charlie, does it feel like you're losing some of that stretch?
I feel it in my abs a lot.
Yeah, I think you need to keep the top. It looks like you're flattening as you go back. So let's have another look. Keep going. So, what I would think, maybe knees can maybe come a bit closer. Do you feel?
That was comfy when I was on my knees.
Oh, okay. So now you want to really tuck your tailbone under. Yes. Now keep it like that. Yes. Now go back. That's very different.
I feel it in my abs.
Yeah, I think it's because you're having to use your abdominal muscles to tuck the tailbone under. Because whenever you're moving, it's the opposite muscles. They work as antagonists. And once you get kind of used to doing it, you can use more of your hip muscles to tuck. Even your pelvic floor. Maybe you engage your pelvic floor a bit more. So that's maybe why you're feeling it in the abs, because you're using those muscles to create the tucking. So maybe squeeze and lift your pelvic floor muscles and see if that kind of takes a little bit. Good. Okay, and then come all the way up onto your hands and onto your knees. So we can do a similar move and actually get into the upper back as well. So we can take the left hand to the outside of the right hand. And then we do the same thing again. Roll the spine to the ceiling. Keep it rounded. Take the hips all the way back onto the heels. And now you might get a really strong stretch through the left scapula. You don't want the hips to come over to the right. So So you want to keep the hips going directly back, but you want to feel that opening in the left shoulder, left scapula. Okay, you can hold it for a couple of breaths, breathe into that left shoulder. And then just rise, all that push into the shins. Come back to neutral, and then right hand goes to the outside of the left hand. Roll the spine to the ceiling, tuck the tailbone under, and then ease gently back towards your heels. And then again, just maybe holding it for a few breaths where you get that stretch into the right shoulder blade. And then gently rising all the way back up. Okay, so taking the right leg all the way back behind you. So this is a good calf muscle stretch. So if you're getting cramp at night, as the vast majority of pregnant women do, this is a really good stretch. So you're going to actively push your heel away. And just hold that stretch until you feel that the calf muscle has given up some of its resistance. So again, if you get this at night, do the stretch before you get into bed. It's a really effective anti-cramp stretch. Now we're going to do something really unusual here. So if you just want to relax your knee for a moment, you can even come and sit back if that feels more comfortable. So this is a really unusual practice that was taught by one of the forerunners of bringing pregnancy yoga to the UK, a French lady called Françoise Freeman. She runs the Birthlight organisation, and she teaches this practice because she noticed that a lot of women, their glutes are too tight. It's never been my problem. But if the glutes are quite tight, then obviously, that's going to stop your baby from coming out when the time comes. So she did this kind of, in fact, you'd probably call it twerking now, but independent twerking, like just one cheek at a time. She called it buttocks. Nobody knows what, she's French. Buttocks. So basically, from this position, you just have to kind of wobble and shake. So you almost have to drop the knee down and just get a bit of a wiggle going into that right buttock. And it's just a way of getting rid of any tension that you might have in the buttocks. So if you give it a go. Buttocks. Who knows where that came from? So that right leg again stretches out. So left knee flat on the floor, and then you might need to bend the right leg just a touch, because I found that holding it straight I couldn't get, but if I bend it, I can really get some jiggle into everything else shapes. yeah. There is that. Okay, and then coming all the way back, and then we're going to do the same on the other side, which I'm not going to do again because of my injury. So left leg comes back, tuck the toes under, and then you're going to push the heel away. And just find that stretch in the calf muscle first. Notice if it feels different. Do you have a different sensation this side? Is it tighter on this side? Is it looser on this side? Again, notice if that's the case. Just noticing that you've got these asymmetries in the body. Nothing unusual about that. And then see if you can do your buttocks on this side, so dropping the knee down just a touch and then shaking it for all your worth. And then when you're done, you can come back. So we're going to come up to standing now. I'm going to give you the option. If you feel quite dynamic, then you can come into a downward facing dog, and then from there you can walk your hands back or walk your feet forwards and uncurl. If you're not feeling dynamic, today, then you can come up from here, tuck your toes under, lift, and uncurl. So it's exactly how, or squat up, yep. However you feel. It's too far. Must be lovely watching these videos at home, just seeing me just lurching forwards and backwards. Okay, so we're going to do a little bit of squatting. So again, good for the thighs, quite nice for the back as well. So you're going to have the feet hip distance apart. Bring the palms of the hands together. And then we're actually going to take the palms out to the sides as we come down into our squat and then bring them back as we inhale. We're also going to use another of our birthing breaths. So this is a much more dynamic one. It's got a lot of power behind it. And it's one that I recommend you use if you're kind of feeling a little bit disempowered in your labour, if you're kind of losing confidence, then this is a really good, it's like a lioness roar. You don't have to do it quite as strong as that, but that's the energy behind it. It's that kind of silent, you know, if you imagine that if a woman was going to roar, that's how we do it. It would be Pat talking about lions roaring. What a great day it's been. Did anybody else like send? I was sending texts to every man I know going, that is how you do football. So yes, lionesses roaring. Yeah, because they just went about their business quietly. No fuss, just did their business. This is how women roar. So, what it's going to look like, going to breathe in. And then on the out breath, you're going to bend the knees, drop into a squat, and just push the arms out to the sides. And then we inhale and we come back. Now, we'll add the breath in a minute, because I couldn't breathe and give you the instructions. Now, in terms of what happens here, if you come forwards, then it's quite an effort on the back. If you try and stay upright as much as you can, there's more happening in your thighs. You're going to get the burn in your thighs, okay? So as you do these squats, see if you can keep the pelvis upright. So it's more like this, not like that. Okay? So inhaling. As you come up, squeeze your pelvic floor, push your feet into the ground. Is that okay with the legs that wide? Does that feel better than having them sort of neutral? Okay. So Melissa, can you see your coming forwards?
Pretty hard. My natural instinct is to
I'm going to maybe take the feet a bit wider then, see if that suits you better. Is that a bit easier?
Like that.
Yeah, just trying to stay as upright as you can. What's stopping? Is it your thighs?
Yeah.
Are they just going, no, I'm not going to do that? So maybe just don't come down as far. Are you still feeling that?
Yeah.
Yeah, so.
Quads are tight.
Okay. Okay, lovely. And then we're going to bring the hands on the hips. And we're going to do a little bit of belly dancing. So this is a nice move to kind of create a lot of space in your pelvis. Really good for helping babies get into the head down position. So if you're kind of coming towards the 34-week mark, if it's your first pregnancy, maybe a little later in subsequent pregnancies because there's more room. This is a really nice way to help to get your baby into a nice position. So you can take the feet a little bit wider. You're going to bring the hands onto the hips. And we're just going to start by lifting one hip and then lifting the other hip. Now this movement, if you'll notice, it's all coming from my legs. Look at my spine, not moving. It's not this. The spine isn't moving. It's all coming from the hips, coming from the legs, coming from the thighs. And so I'm dropping one hip on one side and the other hip lifts, and then I'm swapping sides. And what this is doing is kind of creating, you can imagine your womb inside, all that space being created for your baby. So we can double this up now. You can do 2 to one side, and 2. So I think some of you have heard me say this before, but belly dancing was a Middle Eastern exercise practice for pregnant women. It started off as a pregnancy practice, and then it turned into, you know, glittery, spangly tops and shimming. But originally, all these moves were designed. So let's do a full roll all the way around, full belly dancer roll. They were designed as exercise for pregnant women. And you can kind of see why, can't you? It's very kind of nourishing for the whole pelvic region. So again, with this full roll, is the spine upright? Is the upper body going as well? Can you isolate the pelvis? It's not easy. So just be aware. If you feel that your spine is doing most of the movement, and it comes from the knees. Again, if the legs are straight, there's nowhere to go but into the spine. Whereas if the knees are bent, you can keep the spine upright. Nice, Melissa, you've got that? Got that, lovely. Okay, and then you give everything a shake, so jiggle. So just like we did the buttocks to the whole body now, so this jiggling, rebounding, it gets rid of any tension in the whole of the body. So you can just jiggle to the whole body. It looks a bit funny when, you know, women do not want their bits jiggling, do they? But it is really, really good. Jiggle the bum, jiggle the body, jiggle the shoulders. And then, when you've done that, notice that kind of sense of freedom. Everything feels loose now. It's a really good practice, rebounding. Okay, where are we? Yeah, maybe one more. So, we're going to do some balancing. So if you're not feeling very secure in your balancing, then I'm going to invite you to maybe just take hold of the wall, and then you can do your leg balance holding the wall, okay? Don't want anyone falling over. But if you're feeling okay with balancing, then you might want to come onto the floor. So particularly if you've got a really spongy mat like I have, you might be better off on the solidity of the ground. So you're going to take the weight into the right foot, and then just plant it down into the ground. We're going to use another of these breaths, straw breath, really calming, very soothing. So this is a breath where you imagine you're breathing out through a straw or whistling without actually making a sound. You can do it on the inhale as well. Imagine you're sucking in through a straw, and you breathe out the same way. Now I just prefer breathing out because it makes my mouth really dry if I do it on the in-breath, but some people really like the inhale one as well. Straw breath. So the next time you breathe in, straw breath or not, let the knee, the left knee, rise up as you take the arms up. And as you breathe out, straw breath, just using the control of that straw breath to come down. And then you're going to swap sides and do the same thing again. So root the left foot down. Inhale. Rise up. Straw breath. And come down. Okay, lovely. Now we're going to add a leg circle in. So inhaling. Left knee comes up again. And this time, on the out breath, take the knee out to the side and take the arms out to the side as well. Inhale, back up. Exhale, straw breath and come down. Same on the other side. So again, if you're a bit wobbly, turn and face the wall or come sideways to the wall. In my experience working with pregnant women, actually, you're the ones that balance better than any other group that I teach. And I think it's because you've got a very grounded centre of gravity. I know it's changing all the time, it's moving around, but Then this is our middle, this is our centre of gravity. And when you're pregnant, you know, you're fully grounded here. So I think it does make a difference with balancing. Okay, so we're going to come into tree pose. That right leg is going to be the standing leg. You're going to turn the left leg out. Got some options. You can keep the toes on the floor and just rest the heel against the inner ankle. So if your balance is a bit wobbly today, that's probably your best answer. Or you can bring the foot to the calf, the inner shin. Please don't hook it over your knees. Not good for your cruciate ligaments. Final one, if you've got the flexibility in the hip, you can bring the foot to the inner thigh. Now drop your gaze to the floor. Don't look at anything else that's moving. Just lift the pelvic floor a little bit, soften the right knee a little bit so you're not locking it, and then float your arms out. Fingertip and thumb touching, elbows dropping down towards the floor, shoulder blades lengthening, and then straw breath again. Gently come down when you're ready. Just ease the knee to the front and then drop it down. And then we're going to jiggle. And rebound again before we do the other side. So now shifting the weight onto the left leg, right leg comes out, and again just finding your place. Where is the best place for you to balance? Here. And then once you've done that, just softening a little bit into the left knee. Lift the pelvic floor, drop the gaze to the ground, float the arms out, so no effort through the shoulders, shoulders are relaxed, palms facing up, elbows slightly dropped, thumb and index finger touching, and then working with your straw breath again, so either the inhale or just the exhale. Lovely, you look like you can stay there all day. So we will come down, so just easing yourself down and then rebounding again, jiggling. And just notice how you feel. Is there any other bit that needs a stretch before we lie down? Has that kind of got you pretty much where you need it? Okay, so we're going to come and lie down for the last 10 minutes. So, when we do relaxation in pregnancy classes, if you're less than 20 weeks into your pregnancy, actually I didn't ask all you ladies, didn't ask where you were in your pregnancy. So you've got a couple of options. Let's have a look. So Kelly, how many weeks are you? 16. Okay, so you can still lie on your back if it's not uncomfortable. It's usually around the 20-week mark that the weight of the uterus compresses the blood vessels too much, but it can happen sooner.
I mean, I'm very fat enough that it's probably happening now. I'm good.
But I think it all depends on the comfort level. So if you feel breathless, if you feel dizzy, if it gives you backache, then yeah, sideline. Okay. Donna.
22.
22. Okay, so you are a side liar. And I think that's it, isn't it? Yeah, anything else I've got? Marvellous. Okay, so as I said before, if you're less than 20, and I think it's just Claire, isn't it? It's just Claire and Kelly, or lie on your side. And then which side you lie on, it doesn't matter. You hear a lot about never lie on your right side. No, rubbish. Absolute rubbish.
Is it?
Absolute rubbish. Okay. Do you know why this is? Because the vena cava is marginally to the right side of the spine, marginally. It's not all the way on the right side, so it really doesn't make any difference.
Even the midwives tell you to lie on your left side.
Yeah, it's just they just monkey say, monkey do. You know what I mean? Ask them why next time.
Yeah.
Ask them why. Yeah. I mean, it's bad enough trying to remember to not lie on your back, let alone only lie on your right side.
I like lying on my front, like
Yeah.
you said.
So it's insane to be just stressing you out even more about just lying. And then also, if you just lie on one side for 9 months, you're going to have really sore hips and a really bad neck. And you roll around all the time anyway, don't you? At least when you lie on your back, you wake up.
Yeah.
And that's the thing. So I know a lot of women say, "Oh, I woke up, I was on my back." No, yeah, you woke up.
Yeah.
It's all working. Everything's working exactly fine. Your body went, get off your back. Left and right side lying doesn't make any difference. None at all.
From all the breathing ones that we've done tonight, and in general, the breathing that you teach, what is the best one to do if you've got like a cough or you can't clear your throat? Because I had COVID in May and I still can't breathe properly, and I'm worried that I'm not going to be able to. I can't do straw in, for instance. That doesn't make me want to cough.
Yeah, we'll just do some draw out then. I mean, it's
I
difficult to
continuously want to
say.
clear my throat. It's so annoying.
Do you know what the Ujjayi is supposed to? In all of the indications that it gives you in old textbooks, it says it gets rid of excess phlegm. I've never found it to do that, but it's not to say that you might not. So you know the Ujjayi.
Yeah.
Is that okay?
Nasal. Yeah, that's better.
Yeah.
But I find that I'm drinking loads to clear my throat, and then I don't want to go into labour with a full bladder continuously. So maybe Ujjayi I'll stick to.
So Ujjayi, and in terms of ones, it's very difficult to say any particular breath that will stop the coughing, just because it's lung spasms, and there's not really any breath work that you can do that's going to minimise that, if I'm honest.
Yeah, the doctors all said, well, we don't know. We haven't had enough people with COVID in pregnancy to know yet. Definitely feel
No
like I
data.
can't breathe anywhere near as deep as I used to.
Yeah, a lot of people have had this, haven't they? But I think Ujjayi, and I think that vertical breathing.
Yeah.
Because your baby's quite high, squishing your diaphragm beautifully, so you've got less capacity. So breathe out.
Yeah.
Get your back ribs moving and get your side ribs moving. So I would do that. Ujjayi, side ribs, back ribs, and see what works. But to be honest, you'll have a burst of adrenaline when you go into labour, and that might minimise a lot of coughing and a lot of to give you more breath capacity, because that's what happens. It's going to shunt all the blood, isn't it, to where it needs to go.
Yeah, typically throat will probably be the least line.
Yeah. I think you'll be fine. I think your body will do what needs to be. You might cough for a week afterwards. Okay, so if you'd like to come down and just finding that side lying position that you're comfortable with. And you might need to support your head, you might need to support your bump, you might need to support your hips. So find what works for you. And again, if lying down isn't particularly comfortable, then you're very welcome to stay in a seated position. And then once you have settled yourself, start this process of completely relaxing everything down. So cultivating a sense of letting go. Turn the palms up, and then that kind of drops the shoulders down. In terms of the legs, it's nice to have the knees bent because it's better for the back. And what I'm going to do, take the feet a bit wider and just drop the knees in. Because what you want to do is let go. Find a position your feet where you can actually bring the knees in, and then there's no muscles working. Does that feel a bit better? just allow your breathing to find its own gentle, soft rhythm. So no effort, just watching the breath come and go. I'm just feeling that your breath is like the ocean waves. The waves roll in and the waves roll out effortlessly, endlessly. And our breath works in the same way. The breath rolls in and the breath rolls out effortlessly, endlessly. And then shifting your awareness from these wave-like movements of your breath, and take your attention down into your baby. And just for a moment, place your awareness into the sensations that your baby is experiencing. So your baby is currently floating effortlessly around in a protective sac of warm fluid. Just imagine how that would feel for them, floating around effortlessly, being held in this supportive, nurturing environment. And they're protected from bright lights. You can just see slight variations in shade. And they're protected from sound, just hearing the muffled sounds of your voice, of your heart beating. And then as you continue with this connection to your baby, you might want to just send a quiet message or just a sensation of unconditional love down to them. And this is the beginning of this unbreakable bond, a strong emotional connection that you will have with your baby forever. And then from here, you can gently externalize your awareness, moving away from the image of your baby, moving away from the feeling of the wave-like breath. Move your awareness into all the sensations in your physical body. Notice how it feels. Be aware of the room around you. Be aware of the people around you. And then maybe take a long, deep breath in and then a deep sigh out. And then start to bring a little bit of movement into your body. Just moving your fingers, moving your toes. Having a stretch in any way that feels good. And then in your own time, just slowly find your way back to sitting. There's no rush, just come up in the way that feels right for you. Take your time. And take a moment to notice how you feel. And then take the arms up and over the head. Maybe have a last little stretch. We didn't do much on the upper body and the shoulders, so maybe this is time. And then just resting your hands back down onto your baby. And we'll close the practice by chanting Om. And you don't have to do this, you can just listen. It's really just an extension of the work that we did with our bee breath. Creating a sonic massage for your baby. So if you'd like to join in, take a breath in. Thank you so much for being here. Have a wonderful week.